Good evening, everyone. Myself, ARSHDEEP SINGH, Assistant Professor, Mira Medical Institute of Nursing and Hospital, Bohol. So today I'm going to continue with the starting with the new topic, that is hypertension. Okay. So today's topic will be hypertension. So let's start with the topic. Okay. So today's topic is hypertension, and as we already know that hypertension is one of the major issues in the community. So a number of people, I would say, uh, the number would be in lakhs, that the total number of people who are suffering from the hypertension. So it is a situation when the blood pressure of the body or the heart has to function more, or is exerting the pressure on the arteries of the body, and the blood pressure of the body will be, if we assess the blood pressure, if or we want to assess that is the person hypertensive or not, so we have to check the blood pressure, and the blood pressure readings could be not less than the 140 by 90 mm of Hg. Okay, so as we know that the normal blood pressure of the body is 120 by 80, but in case of hypertension it would be not less than the 140 by 90 mm of Hg. So there are three stages. Okay, I will explain it later. So first of all is the introduction. So normal blood pressure is 120 mm Hg systolic and 80 mm Hg diastolic blood pressure, and that is 120 systolic and 80 diastolic is taken as normal blood pressure in adult at rest. So this is the normal range of the blood pressure. Then the systolic blood pressure up to 140 and diastolic up to 90 is considered in normal range. But blood pressure of 140 by 90 is taken as a cutoff point between normal and hypertensive clients. So this is the point in which we can say that this is the point that differentiate a person from having the hypertension or not. Okay, so this is the point in which we can say that if the person is having more than blood pressure more than 140 by 90, that person, either female or male, can be a hypertensive patient. So those having systolic blood pressure between 120 by 139 mm Hg and diastolic between 80 to 89 mm Hg are considered pre-hypertensive. So this is the stage in which the if the blood pressure falls in between the 120 to 139, and in case of systolic, and 80 to 89 in case of the diastolic, then these type of persons will be in the range of hypertensive stage. Okay, so moving on further, there are three stages, as you can see. First of all is the mild stage, that is in this the systolic BP would be from 140 to 159. That is a stage 1, and the diastolic BP would be 90 to 99. So you have to learn this, that these are the stages, that is stage 1, stage 2, and stage 3. Stage 1 is the mild, stage 2 is the moderate, and stage 3 is the severe. So moving on is the moderate stage, stage 2, and in this condition the systolic BP is 160 to 179, and the diastolic BP is 100 to 109 mm of Hg. And in case of the severe condition, that is stage 3, the systolic BP would be more than the 180 mm of Hg, and the diastolic BP would be more than 110 mm of Hg. So these are the three stages of the in the hypertension. Okay, so we can have the different category of the patient, that the patient might be suffering from the mild hypertension, moderate, or the severe one. So that is the range. Okay, next is the classification. So there are two classifications, that is primary and the secondary hypertension. So it has been classified into two types. First of all is the primary, that is essential, in which causes are not known. So that is the difference between a primary and a secondary type of hypertension. Okay, so in this type, in primary hypertension, the person is hypertensive, but the causes are unknown, and it accounts for 90% of the cases of hypertension. So most of the cases, or the major portion of the hypertension tension cases, uh, is of the primary hypertension patients, and the secondary hypertension, which occurs due to the diseases like those of kidneys, tumors of the adrenal glands, and these accounts for about 10% or less of the cases of hypertension. Okay, so there are two categories, primary and the secondary. Primary is one in which the causes are known, and the secondary is one in which the primary is the one in which the causes are unknown, and the secondary in which the cases are the causes are known, and that only accounts for the 10% of the total cases, and the primary one accounts for the 90% of the cases. Okay, next is the magnitude of the problem. Magnitude means to say what total number of the cases of the persons, what is the magnitude of the problem. That means the how much this condition is affecting the people in the community. For example, the hypertension is a worldwide problem. It is estimated to cause about 7.5 million deaths worldwide, and about 12.8% of the total all annual deaths. So I would say that hypertension is the first stage of every heart disease. I would say if the person is hypertensive, then he or she is at the risk that he or she might be having the other types of heart related diseases in future. Okay, so about 1 billion people were hypertensive in 2008. So that is a huge amount of people, a huge number of people that were suffering from the hypertension. That is 1 billion. Okay, and according to WHO 2011, it includes 40% of the adults 25 years of age and above who have hypertension. Okay, that is the magnitude of this disease or the condition at the worldwide level. Okay, next is the prevalence in India. So that was about the worldwide magnitude of the problem. Next, I will talk about the prevalence in India. So there is an increasing trend of hypertension due to sedentary lifestyle and faulty eating habits in India. So, talking about the condition in India, so I would say then in India we are having a people with the different religions, different culture, different lifestyles. So there is a diversity in the lifestyle or the cultural and the religious beliefs. So that diversity is, I would say, according to the cultural beliefs or the religious beliefs and the sedentary lifestyle. So that is affecting the persons. Okay, so and that some due to the sedentary lifestyle, like the eating habits, like in today's world we are eating more number of the foods like the pizzas or the burgers that are having are in the category of the fatty foods. Okay, so they will result in the cases of more number of cases of the hypertension. Okay, in an ICMR survey conducted during 2007 to 8 in the states of the Andhra Pradesh, Kerala, Madhya Pradesh, Maharashtra, Uttarakhand, Tamil Nadu, and Mizoram, prevalence of hypertension was reported to be between 70 to 21% in all the states. So, in the total number of the 100% cases, 17 to 21% of the total cases were a big part of the total disease were due to the was due to hypertension. Okay, next is the epidemiology of hypertension. So in epidemiology, it would include two parts. That is the modifiable risk factors, and second one would be the non-modifiable risk factors. Okay, so modifiable means to say the risk factors which we can modify and prevent the further worsening of the condition, like the hypertension. Okay, so what are these modifiable risk factors? The factors which we can modify so as to prevent the cases of the hypertension. These include, first is occupation. Sometimes we are working in an occupation or in an institute or the organization which is having a stressful conditions, or the lifestyle is lifestyle due to that occupation is not run in a proper manner. Okay, so there is the destruction of the lifestyle, like the sleep is not proper, diet is not proper. Okay, so that would lead to the sedentary lifestyle, and that would lead to the risk for the hypertension. But we can modify this factor, and we can prevent the cases of hypertension. Like certain occupations which produce stress predispose people to develop hypertension, such as doctors, lawyers, business executives, and engineers. So these are the persons who fall in the occupation that are at the risk of having the hypertension on the priority basis. So different techniques has to be used so as to manage the cases in these type of occupations. Second is the socioeconomic status. Hypertension is more common among affluent class, but with changing lifestyle, this is now found to be also increasing among the lower socioeconomic class. An inverse relationship has been seen with the level of education, income, and occupation. So we can say that the lower socioeconomic class or the middle class are nowadays affected by the hypertension in a many ways, and they are at the risk of having a lot of a number of people in India now. I can say that lakhs of the people are suffering from this condition like the hypertension. Okay, so that is also a factor that we can modify and prevent the cases of hypertension. Next is obesity. According to me, that is the main cause for the hypertension. Obesity is directly related to hypertension, particularly central obesity, that is increased waist to hip ratio. So when obesity is present and the person is obese, then we can say that specific person is on the risk of having hypertension, and later on he or she would be on the risk of having the various types of heart diseases. So to prevent yourself from the hypertension, you should be or might be uh, not having the too much of the weight. So you just need to improve your weight up to the extent that that is enough, okay, for your survival. Okay, not less or not more. Next is salt and other factors in the diet. That is also important factor, and but we can also modify this factor. Diet rich in saturated fats and sweets predispose to obesity, which in turn related to the hypertension. High salt intake, that is 7 to 8 gram per day, increases blood pressure, whereas potassium antagonizes the effects of salt and lowers the blood pressure. So if we are taking the high salt diet in our daily routine, so there are the chances that we can be suffering from the hypertension in the early stages of the life. Like I would say that now uh, the persons who fall in the age of the 20 to 30 or 30 to 40, so they are also getting affected by the situation of the hypertension. So we have to be aware, and we have to be careful about our diet, that what we are eating. Are we eating enough salt that is okay for our survival, or we are exceeding the limit? That means uh, it is written hereby that 7 to 8 grams per day, it is much more than our the required quantity. So we have to think about that. Okay, so we just have to eat that type of diet in which the salt intake is just appropriate, that is needed by our body. Okay, so salts and other factors are also contributing to the hypertension. Next is sedentary lifestyle. So those people who lead sedentary lifestyle and engage in minimum physical activity and exercise have risk for developing hypertension than those who lead active life and exercise. So it is obvious that if you are having less physical mobility, you don't do exercises, you don't move, and you just live a comfortable life. I don't say that you don't live a comfortable life, or you don't use any type of comfortable devices, but it is also important that you just do some of the work, or you have to perform different activities, like you should do exercise for 15 to 20 minutes or 20 to 30 minutes for a day in daily. Okay, and you just maintain your diet, and you just avoid smoking and alcoholism. So these are the factors that we can modify, and we can change our lifestyle, and that would lead to prevention of the hypertension that will affect our body. Next is the diabetes mellitus, and it is obvious that it is seen that the person who are diabetic, the diabetic condition also predisposes to the hypertension. Okay, so these were the main, uh, we can say that the modifiable risk factors, which are the reasons for the hypertension, but we can modify them and prevent ourselves from hypertension. Next, second is one is there is the category that is non-modifiable risk factors, means to say that these are the factors that are also contributed to the hypertension, but we can't modify them. Okay, for example, some of the factors like age, we can't change age, we can decrease or increase age by our own self. Okay, so it is a continuous process, it will increase day by day, but we can manage our lifestyle, but we can't manage our age. Okay, so that is why it is a non-modifiable risk factor, and it is seen that hypertension mostly affect the persons who are above 60 years of age, 40 to 50. So this is the age range for the hypertension. It is seen that hypertension increases with the age in both sexes. There is probably cumulative effect of environmental factors as the age advances, and the prevalence of the hypertension is high in the age groups above 40 years. So it is written hereby that the above 40 years of the persons are uh, having more risk than any other type of age age group. Next is second one is the sex or the gender. So young and middle-aged adults, so from both males and females, males have a higher blood pressure level than their female counterparts. After menopause, the women have higher blood pressure, maybe due to hormonal changes. So before menopause, uh, we can say that if we compare the male and female uh, on the scenario of the hypertension, so we can see according to survey reports or the evidences that males are more prone to the hypertension and as compared to the females, but after the menopause females are also on the having the risk for having hypertension. Okay, because as the age changes and there are the hormonal changes in the body, and that can lead to the risk factors of the hypertension. Next is the genetic factors. Genetic factors play an important role in the inheritance of hypertension. Children whose both parents are hypertensive have 45% of developing hypertension as against 3% among those whose parents are uh, normotensive. Okay, so it is seen that mostly the persons who are having the heart disease or the hypertension cases in the family, it is seen that they are inherited, or we can say that it is transmitted from the uh, it is present in the family in different generations. So that is the factor, that is genetical factor, we can't change that. Okay, and last is the ethnicity. Hypertension prevalence is higher among black people, for example black Americans, than other among ethnic groups. So according to the race, hypertension also varies with the uh, uh, we can say that the different ethnicity of the people. Okay, so that is also non-modifiable risk factors. Next is about the prevention, control, and role of nurse. So I have explained you about the introduction and what are the risk factors which contribute to the hypertension. Next are the about the prevention, control, and role of nurse. So there are three levels by which we can prevent the hypertension, that is primary prevention, secondary prevention, and tertiary prevention. So first of all is the primary prevention, that includes population strategy. So in this is the population strategy. First of all, in the primary prevention, this is aimed at the whole population, that is why it is given the name of the population strategy. So how we can implement the population strategy, these are the different ways. Firstly, to advise people to eat well balanced diet. So it is obvious that I have explained you in the modifiable risk factors that if we can change our lifestyle, we can prevent ourselves. So that is the point. If we are eating a well balanced diet in which the salt is according to the appropriate amount, or the micro and the macronutrients, and each and every nutrient is in present in the proper amount that is required by our body in a normal range. So uh, that is the thing, that we have to eat a well balanced diet, and that will prevent our body from from being getting infected from the cases of the from the, you can say that the condition of the hypertension. Okay, so that is reduce intake of fats and limit intake of salt, that is 5 gram per day. So we have to cut short our diet according to this scenario, and they should limit intake of the alcohol. So we also have to uh, manage the use of the alcohol and avoid the cigarette smoking, and they should include fruits and vegetables in diet to increase the fiber content, and that will lead to the uh, prevention from the hypertension. Okay, Next is a dash, that is dietary approaches to stop hypertension. Diet high in fruits, vegetables, and low fat dairy products has been shown to lower hypertension. So these are the things like the fruits and the vegetables, and diet low in the fat and dairy products will lead to the prevention from hypertension. Next, people should be advised to control weight. So that is the point that relates with the obesity. I have already explained. If you are having weight more than the normal range, then you can be at the risk of having the hypertension. So you have to manage your weight according to your age or your height or according to your condition, so that you might not be getting affected from the hypertension. Third is the health education, and that is one of the basic points. We have to educate the people about what is hypertension, what are the risk factors, how can we prevent ourselves, and what are the complications after a person is getting infected from the hypertension. So we have to provide health education to people at large level. And when the students are we can say they enroll in the community duty, so they do the home visiting, and most of the students, the common topic for the students for the health education is always is the hypertension. So they try to aware the people that this is hypertension and this can lead to the various types of heart diseases. So that is the best possible way and cost effective method, I would say, that from which we can prevent a number of people at the mass level from the hypertension. Okay. Next is the self-care. That is also an important point. If you will not care for yourself, you might be getting from the different be getting different infection and the diseases. So hypertension is one of that. So people should be advised to control weight, maintain weight record, take treatment properly, take proper diet, and do exercises. Thanks. So that was about the population strategy. Next is high risk strategy. So that will include the people who are having the high risk of having hypertension. That hypertension would affect these kind of people. For example, this is aimed at identifying high risk individuals, that is obese people who have family history of hypertension, diabetics, alcoholics, pregnant mothers by taking and recording their blood pressure. So that I would say that is the target group for high risk strategy. So these are the category of the people who are always at the risk of having hypertension because their bodies are not adapted in a healthy manner, or they are at the risk of having hypertension. So we have to screen these type of people. Screening people would have to identify those who need to be put on treatment, like the obese ones. We have to reduce their weight so that we can prevent them from being getting from in fact affected from the hypertension. Okay, so that was about the primary prevention. Next is the secondary prevention, and as we already know, in secondary prevention there are 2 points: early case detection and treatment. So first of all would be the early case detection. So it includes nurses can help in early case detection of hypertension cases in the community by checking the blood pressure of the general population and identifying high risk individuals and referring them to physician for proper treatment. So that is early case detection. We have to do the home visiting. We have to take the blood pressure of the people. And next, I would say that we have to identify the high risk individuals and then a proper treatment. If we found that the blood pressure of that specific person is high in range and that is at the risk of having uh, hypertension, or he or she is in the prehypertensive phase, then we should immediately refer that person to the physician. Next is the treatment. Treatment of those individuals who are diagnosed with hypertension is initiated by the physician. Nurses should teach them to take accurate dosage of medication. The treatment should be initiated immediately, and dosage should be managed by the nurses. And follow-up should be done, and lifelong treatment is needed by such patients, so that they should be encouraged to continue and comply with the treatment. Different types of drugs are given by which we can prevent the blood pressure from getting increased, assist the patient to develop and adhere to the proper exercise regimen, limit the use of alcohol, stop smoking, and I would say, and consult a dietitian to develop dietary plan to improve nutrition for weight loss. So each and every time we are having the same number of same words, like the reduce the weight, avoid cigarette smoking or alcoholism. So this is the we can say that the treatment or early detection by which we can prevent a patient from having the situation in the worst scenario. Okay, and so that was about the early diagnosis and treatment. And at last, in today's topic is the tertiary prevention. So this is the condition when we can say that there is need of the rehabilitation. It is intervention in the late pathogenesis phase. It includes all those measures available to the reduce or limit impairments and disabilities and minimize suffering to the hypertension. We are the person, we can say that we have to delimit the complication. We have to prevent the patient from being getting affected from the different complications, like the person is already hypertensive, but we have to save that person from the various types of heart disease and other disorders of other organs. Okay, the tertiary prevention is for those people who have very high blood pressure and have developed complications, and they are given intensive treatment to limit disability. So that will include the we can say that the use of different types of drug that should be administered to the person in the form of injection or the tablets. And if already disabilities such as hemiplegia, speech, and other physiological complications have developed, they are rehabilitated through speech therapy, physiotherapy, and occupational therapy. So that is about the tertiary prevention. Okay, and so that was all about the today's topic, that was hypertension. Okay, so in today's topic, I have explained you about hypertension, its introduction, its stages, its classification, and the scenario of the hypertension at world level and it at India level. Then the different types of epidemiological factor, like the modifiable ones or the non-modifiable ones, and last is prevention, control, and role of nurse. So that was about today's topic. So thank you everyone. I will meet you in the next week with new topic, new disease condition. Thank you very much.